Hello, my name is Alexia Sawyer, and this is my Symposium for speech. The movement to decriminalize psilocybin in the United States began in the late 2010s, with Denver, Colorado becoming the first city to decriminalize psilocybin in May 2019. The cities of Oakland and Santa Cruz, California followed suit and decriminalized in June 2019 and January 2020, respectively. Psychedelic assisted therapy has potential to heal trauma, but individual therapy alone cannot solve the systematic issues that often cause trauma. This also requires advocating for comprehensive harm and risk reduction, including honest and culturally relevant drug education, legal and accessible substance analysis, peer support, and accessible services for mental health and integration. It is believed that healing is intertwined with justice, and that social, political, and cultural progressiveness creates fertile ground for community healing. In this speech, I will talk about how not legalizing the use of psychedelics can be harmful, why legalization of such drugs opens doors for misuse and overdosing, and allows for an easily accessible market, and what benefits the legalization has for those who have suffered from trauma and illness, and how a controlled environment can lead to safe usage and beneficial psychedelic and post-traumatic stress disorder help. Not legalizing the use of psychedelics can be harmful. According to Vox.com, on January 27, 2016, Charles Grobe, a UCLA professor of psychiatry and pediatrics who studied psychedelics, conducted a study that gave psilocybin to late-stage cancer patients. He states, "The reports I got back from the subjects, from their partners, and from their families were very positive, that the experience was of great value, and it helped them regain the sense of purpose and sense of meaning to their life. The quality of their lives notably improved. Without the use of this psychedelic, these results would not have been seen." Bloomberg Opinion states on May 15, 2021, "A striking new study published in Nature Medicine argues that MDMA-assisted psychotherapy represents a potential breakthrough treatment for post-traumatic stress disorder." Related to this, APA.org states, "Antidepressants that affect the balance of serotonergic and noradrenergic neurotransmission, or which alter serotonin neurotransmission through other mechanisms of action, are also helpful in PTSD, but a common side effect of current antidepressants is thoughts of suicide and self-harm." With psychedelics, these side effects are less likely in patients who already have thoughts of suicide or self-harm. There are many issues and uses for psychedelics that would be lost if they were kept illegal. But there are many side effects that are less desirable with their legalization. Legalization of such drugs opens a door for misuse and overdosing. According to Ocean Recovery Center, if the government taxed the legalized drug market heavily, drug gangs could still operate. This can involve producing or smuggling the substances and selling to consumers at lower prices or selling stronger versions. They also state it is often argued that more people could experiment with drugs if they were legal, and these people would otherwise not do this if it were kept illegal. This could be particularly damaging for people with a genetic predisposition towards addiction. Drugs could become more accessible for many people. Progressive.org states on December 31, 2020, "The medical model also lends itself to exploitation by pharmaceutical companies. Psilocybin mushrooms, for example, can be found in nature and grown at home, but the medical model puts these medicines behind a paywall, with artificial limits on supply. Many people fear that the legalization of psychedelics could lead to addiction and an easily accessible market to those who gain no benefit from the use of these drugs. But are there more pros that outweigh the cons in this battle? What benefits the legalization has for those who have suffered from trauma or illness, and how we can control access and the potential harms that come from the legalization of these drugs. Medical News Today on June 29, 2021 says, a 2016 study of 29 people with cancer who had anxiety or depression related to their diagnosis compared to those who got a single dose of psilocybin mushrooms to those who got placebo, the psilocybin reduced cancer-related anxiety, hopelessness, and dread immediately after the dose. At 6.5 months, 60 to 80% of the psilocybin group continued to report improvements in depression and anxiety. Vox.com on January 17, 2016 states, if the legalization is pulled off correctly, this would maximize the best possible outcomes and minimize the worst. Supervisors could help prevent accidents, and they could walk people through good and bad trips, letting users relax and get something meaningful out of the experience. There are risks to controlled settings as well. If a supervisor is poorly trained or malicious, it could lead to a horrific trip that actually worsens someone's mental state. This is why regulation and licensing will be crucial to getting this idea right. In this speech, I discussed how not legalizing the use of psychedelics can be harmful, why legalization of such drugs opens a door for misuse and overdosing, and what benefits the legalization has for those who have suffered trauma, and how a controlled environment is best when using these legal drugs. Psychedelic-assisted therapy has a potential to help heal trauma, but individual therapy alone cannot solve the systematic issues that often cause trauma. This also requires advocating for comprehensive harm and risk reduction, including honest and culturally relevant drug education, legal and accessible substance analysis, peer support, and accessible services for mental health and integration. It is believed that healing is intertwined with justice, and that social, political, and cultural progressiveness creates fertile ground for community healing. There are so many benefits to the legalization of psychedelics, and there are states who have already dabbled in the research to allow these drugs to be used safely and properly, and it has worked. The more we research, the better the results.